Hi, my name is Heather. I'm going to be your student nurse today. What name would you like me to call you by?
Megan's fine.
It's nice to meet you, Megan. What would you like to talk about today?
Well, I just graduated from college, but I can't seem to find a job. Both of my roommates have found jobs and are moving on with their future, and I'm going to have to move back into my parents' house. Plus, I have racked up a whole bunch of credit card bills, and my parents do not know about that. But now they will because the bills will be coming to their house.
I see. You must be feeling very overwhelmed. Have you had any thoughts of harming yourself or anyone else?
No, nothing like that.
Okay, good. Tell me some more about the feelings you're having.
It all just stresses me out. I feel like a failure. Can't believe I have to move back with my parents. It's just embarrassing. I also don't want to have to listen to my parents complain or go back to following their rules. I'm 23 years old.
So you feel like a failure because you have to move back into your parents' house?
Yes.
I understand how you're feeling. I remember how stressful it was graduating from college and then not immediately having a job. I can remember feeling stressed out. Tell me how you feel physically when you're stressed out.
Well, I just can't sleep at night, and sometimes I feel like my heart is going to pound out of my chest.
Okay, can you tell me a little bit about your eating habits?
Sometimes I forget to eat or I just don't feel like eating.
Okay, see. How would you feel about carrying some small snacks in your purse? This way you could still get some nutrients, but not necessarily have to worry about fixing a meal or eating a whole meal. Not eating can actually add to your stress, make you feel more anxious. Do you think you could carry some small snacks to snack on throughout the day?
Sure, I could do that.
What would you like to see happen after our visit today?
I'd like to get a job and be able to pay my debt back. I would also like to be able to sleep again.
Okay, I would like to set a plan to come up with some ways to reduce your stress. Does this sound okay with you?
Yes.
Okay, how have you coped with your stress in the past?
I've never felt this much stress before, so I really don't know.
Okay, I would like to go ahead and maybe teach you a breathing exercise that you could use to help you when you're feeling stressed or anxious. Is that okay with you?
Yeah, that's fine.
Okay, go ahead and close your eyes. Now, take a deep cleansing breath. Feel the sensation of renewal enter your body. Feel all of your worries and your cares leave with each exhale. Take another deep breath in. Focus your mind on your breath. Feel the air go in and then go out. With each exhale, release all of the air from your lungs. Breathe in and briefly hold your breath. Slowly release all of your tension and stress. Now go ahead and open your eyes. How do you feel?
I feel relaxed. That was nice.
Good. When you're stressed and your heart is pounding, you think you could give this breathing exercise a try?
Yeah.
Good. Do you ever exercise?
Well, I used to, but no, not really anymore.
Now, exercise is a great way to reduce stress, and it also can aid in helping you fall asleep at night. Do you think maybe you could add 30 minutes of exercise into your day 3 times a week?
I could try, but is there any medication that I could take that would help me fall asleep?
There are medications that can aid with sleep, but medications come with side effects that can actually add to your stress and anxiety. Before we try medication, I would like to see you try eliminating caffeine from your diet, start exercising, and do the breathing exercise that I taught you. If after a few weeks you're still having trouble sleeping, we can talk to the doctor and see if he would consider medication. Does that sound okay with you?
Yes, that sounds okay.
What are some goals you could set for yourself?
Well, I want to get a job, and I will start exercising, and I'll stop trying to drink so much Mountain Dew.
Excellent. Those are great goals. How will you go about getting a job?
Well, I think I should submit at least 2 resumes a day for a week.
Okay, good. Have you ever thought about using a career finding agency to help you find a job?
No, I've actually never thought about that.
Okay. So this week, you'll submit 2 resumes a day. You'll begin exercising 30 minutes a day for at least 3 times a week. And you'll cut back on your caffeine intake. Do these goals sound reasonable to you?
Yes, I think I can do that.
Good. I think we've set some good goals, and now you have a breathing exercise that you can use when you're feeling anxious. You can also try the breathing exercises just before you lay down to go to sleep at night or after you lay down, and maybe these will help you clear your mind as well. Megan, the feelings that I would also like you to keep in mind that these feelings that you're feeling, They're not unusual. Keep in mind that many students move back in with their parents after graduation to save money. And actually, moving back in with your parents will provide you with an opportunity to save money and help you pay off your debt that you created.
True, and my parents are really supportive of me.
Okay, good. I would like to see you back in a couple of weeks and we can talk about how things are going. Remember to schedule an appointment with the secretary before you leave. Does this sound okay with you?
Yes.
Great. It was really nice meeting you, Megan. I am glad we got a chance to talk today. I will be talking to the doctor and letting him know what we discussed today and what our plan is. The doctor will be in to see you shortly, and I will see you back in a couple of weeks.
Okay, thank you. Hello.
Hi, my name is Heather. I'm a student nurse. I just met with a 23-year-old female suffering from stress and anxiety. She just graduated from college and she is having a difficult time finding a job. She has had to move back in with her parents and has created a lot of debt. She is feeling stressed and having a difficult time eating and sleeping. She has had no past history of mental illness and has no suicidal ideation. After talking with the patient, I have concluded that she has the typical symptoms associated with anxiety: difficulty sleeping, eating, a rapid heartbeat. I have recommended that she cut back on her caffeine, start exercising, and carry small snacks with her. I have taught her a breathing exercise that she can use when she feels anxious. She is to schedule an appointment back to meet with me and discuss how things are going in 2 weeks.
Okay.